Hello, my name is Dr. Bob DeMaria, the Drugless Doctor, and today we're going to get to know more about sex and romance. What I have learned over time is that stress, sugar, and soy, yes, soy, stops the desire for intimacy in men. You say men don't have the intimacy or desire for intimacy anymore, Dr. Bob? What we're seeing over time, especially after individuals are 40 years old, their desire to engage in intimate activity is lowering. We're seeing more and more men today who have low testosterone. When you have low testosterone, guess what you don't want to do? Engage in intimate activity with your spouse. So let's talk about some reality. Sugar stops sex because it impairs or stops the function of a gland in your body called the adrenal gland. Sugar sabotages sex. That's right. What about soy products, Dr. Bob? I didn't know that soy would interrupt my desire for intimacy. Well, soy is estrogen-based. Men don't need more estrogen. Men need testosterone. So if you are just passionately addicted to soy products, what's going to happen, and soy is basically just about everywhere today, it's going to stop your man's desire to have intimacy. Now, stress is so common today, and I know all of us have different types of stress, even myself. We have just everyday activities. We like to call it the micro trauma of everyday living. It creates stress to the adrenal gland once again. Many of you just need a good night's sleep consistently to allow the adrenal gland to be restored. So stress impairs adrenal gland function. Let me talk to the ladies a few moments right now. And gentlemen, I want you to pay attention to this also, because it does impact you, by the way. Women oftentimes will have tender breasts in between or in the middle of their menstrual cycle or right before their menses. Women that have tender breasts usually have too much estrogen inside of their body. Remember we talked about soy? So ladies, right now, this might be the answer for a question that you've been pondering for a long time. How do you stop tender breast? Stop soy. Another area of concern that I see in our practice, and we talk about, is a heavy menstrual flow. Heavy menses is a body signal to me, a very significant body signal that you in fact have too much estrogen. And what bothers me or concerns me is the fact they may want to take your uterus out or do something even more bizarre called ablation. Ablation was when the uterus itself is actually cauterized so you don't have a menstrual cycle anymore. Doesn't it make more sense to get to the root cause of the problem? And that would be minimizing estrogen. And then also, let's focus on clearing up the liver function. So your liver processes estrogen inside of your body. Ladies, do you have issues with lack of lubrication or dry vagina? Say, dry vagina, Dr. Bob, what could cause that? Stress. Many of you right now that are listening to me have issues with depression. Depression is very common today in America. They estimate up to nearly 20% of the people in the United States today are depressed. Depression and antidepressants can literally zap one's libido. What's libido, Dr. Bob? Your desire for intimacy. How about your cholesterol? Do you know your number? Well, what we have found in our patients who have high cholesterol, and if they've been placed on any kind of medication, especially a statin medication, Guess what statins do? And I'm not saying this to be silly. It affects a man's ability to arrive at and then achieve an erection. That concerns me because I have patients that come in and they say, Dr. Bob, I'm taking all these medications and I'm not able to have and able to perform. They have erectile dysfunction. It can be entirely based on the medication that they're taking. So antidepressants can decrease one's libido. Statin drugs can interrupt normal function. Do you want to know how that happens? Because when they give you a statin drug, it takes the cholesterol out of your body that's used to make sex hormones. I would much rather have you eat Dr. Bob's ABCs, apple, beets, and carrots. That'll help lower your cholesterol naturally. Now men, if you're having issues with low libido and lack of testosterone, we actually use something in our office called maca root. Yeah, maca root. I know it sounds really wild, but we have had great success with our patients' libido and improving testosterone and estrogen levels. If you have depression, have your thyroid gland checked. Make sure you're taking enough B as in Bravo vitamins because that helps depression also. Adequate oil, at least 1 tablespoon of flax oil per 100 pounds. That'll help give your body the hormones that it needs to help restore function. You see, getting healthy will promote your desire, your passion, wants to, again, to engage in intimate activity and sexual function with your mate, which I know is just so important. Just because you're at an age that you lost that desire does not mean that it can't return. You need to take the time, make the appropriate adjustments to your life and to your lifestyle so your body will be healthy, restored function, and once again, everybody will be smiling. I'm Dr. Bob DeMaria, the Drugless Doctor. Look forward to speaking with you once again.